What is chlamydia?
Chlamydia is a sexually transmitted disease caused by the gram-negative obligate intracellular bacteria Chlamydia trachomatis. It can cause inflammation of the male and female reproductive organs, leading to problems in fertility. Chlamydia trachomatis requires an intracellular habitat because they are unable to synthesize ATP and depend on the host cell for energy. In the United States, it is the most commonly reported sexually transmitted infection, with females aged 14 to 24 being the most affected individuals. Majority, however, do not present with symptoms. In the Philippines, studies have shown that chlamydia infections are the predominant sexually transmitted infection among sex workers and pregnant women. It is also reported to be the most common sexually transmitted disease of 2021. Transmission of this parasite is either through unprotected sexual intercourse or through childbirth, where infected mothers transmit it to their babies. Some risk factors for primary infection include being less than 25 years of age, having more than one lifetime sexual partner, using condoms inconsistently or inappropriately, having a history of other sexually transmitted infections. The most frequent site of infection is the vulva, but the urethra, rectum, and cervix may also be involved. Due to the inflammation of the infected organ, symptoms of this disease include painful urination or dysuria, hypogastric pain, abnormal vaginal discharge, penile discharge, testicular pain, intermenstrual bleeding, and dyspareunia. Lymphogranuloma venereum is a less common presentation caused by 3 unique strains of Chlamydia trachomatis. It starts out as a shallow painless ulcer that heals without therapy. After 1 to 4 weeks, it develops into a markedly painful lymphadenopathy in the inguinal and perirectal areas. At this point, people may develop malaise and fever, and if left untreated, the infected lymph nodes become increasingly tender, enlarged, and matted together, adhering to the skin, forming what is called a bubo. Within 2 weeks, the bubo will rupture spontaneously in the form of multiple draining sinuses and fistulas. This extensive tissue destruction may lead to scarring and fibrosis, resulting to stricture formation of the anal canal and rectum. Screening must be done for the following: if your partner has symptoms or is diagnosed with chlamydia, sexually active women younger than 25, older women with more than one or with new partners, pregnant women, men who have sex with men, gays, and bisexuals. We can screen for chlamydia through the nucleic acid amplification test, or NAAT. This is the gold standard in diagnosing Chlamydia trachomatis infection. The NAAT is mostly based on polymerase chain reaction, or PCR, and uses fluorescence-labeled probes to detect amplification products in real time. The specimens used for testing are the following: vaginal or cervical swab for women, rectal or urethral swab for men, first void urine for men and women with urologic symptoms.
So how do we manage chlamydial infections? First is we have to prevent adverse reproductive health complications and continued sexual transmission. This includes treating not only the patient, but his or her partners as well. We also treat pregnant patients to prevent the infection of her baby at birth. Management should not be delayed to prevent complications. The recommended treatment plan for chlamydial infections among adolescents and adults include doxycycline, given at 100 mg orally 2 times a day for 7 days. This is also available in a delayed-release 200 mg tablet that can be taken once daily for 7 days. Alternative medicines include azithromycin 1 gram taken orally as a single dose, or levofloxacin 500 mg taken orally once a day for 7 days. Your doctor may advise abstinence to minimize disease transmission and reinfection. Your intimate partner should be managed as well, as he or she has a high risk of infection. Lastly, follow-up and continuity of care is important to detect other sexually transmitted infections, ensure that treatment is successful, and to prevent reinfection. When treated, nearly all patients are cured with the current appropriate antibiotic therapy. According to the US CDC, if untreated, chlamydia can spread to the uterus and fallopian tubes, causing symptomatic pelvic inflammatory disease, or PID, which occurs in 10 to 15% of women with untreated chlamydia. These can cause permanent damage to the upper genital tract, including the uterus, fallopian tubes, and surrounding tissues, which can lead to chronic pelvic pain, tubal factor infertility, ectopic pregnancy, perihepatitis or Fitzhugh-Curtis syndrome, reactive arthritis. In pregnancy, it can lead to preterm delivery, ophthalmia neonatorum, pneumonia in the newborn, and in general, these infections are associated with increased risk for other sexually transmitted diseases such as HIV and HPV. Prevention is key, and primary prevention is recommended for high-risk individuals. This includes counseling on safe sex, use of condoms, abstinence from vaginal, anal, and oral sex, or to be in a long-term mutually monogamous relationship with uninfected partners. Once diagnosed, sexual contact tracing up to at least 3 months from the diagnosis is done. Routine screening for common co-infections such as Neisseria gonorrhea and Treponema pallidum is conducted as well. Secondary prevention includes annual screening for all high-risk patients, screening among pregnant women, and retesting for successful treatment or reinfection. Lastly, neonatal eye prophylaxis for newborn infants prevents ophthalmia neonatorum caused by untreated chlamydia. So there you have it, ladies and gentlemen, everything you need to know about chlamydia. Don't forget to like, subscribe, and share. Peace!